Afternoon. Welcome to this Health and Welfare Committee meeting. My name is Tina Sablan. I am the chair of the committee. Are we recording? We're live now. Okay. Thank you. Today is February 14, 2022. Happy Valentine's Day. Happy Super Bowl day. It is now 2:00 p.m. and I call this meeting to order. Present today is our Vice Chair, Representative Leila Staffler, and members of the committee, Representative Sheila Babata and Donald Manglonia. Representative BJ Atta is on his way. Staffing the committee today is our legislative aide, Ms. Malia Johnson, who is keeping the meeting minutes for this proceeding, and legislative bureau staff are our counsel, Joe Tyron, legislative assistant, Claire Sablan, and our IT guys, Del Camacho and John Diaz, as well as our Sergeant at Arms, John Santos. A couple of housekeeping things. We do have on the agenda a panel briefing on the Commonwealth's COVID-19 response. Those panelists have all confirmed their availability for tomorrow at 1:30 p.m. And so we will recess this meeting at the end of the markup portion of the agenda, and then we will continue tomorrow afternoon at 1:30 p.m. Members, do you have any questions on this? Okay, thank you. And with that, may I ask for a motion to adopt our agenda for today? Motion has been made and seconded. All in favor of adopting the agenda, please say aye. All opposed, please say nay. Motion carries. This agenda is now adopted. Our next order of business is the adoption of minutes. Colleagues, did you receive copies of the meeting minutes for August 27th, October 18, and December 6th? And did anybody have any comments or corrections they'd like to make at this time before we adopt them? Okay, I actually did have a couple of comments that I wanted to read into the record. One is just to allow our legislative assistant, Ms. Johnson, to make some technical corrections. In general, I'd like to see, there's an awful lot of acronyms that are used throughout the meeting minutes, and I'd like to see those spelled out first before we refer to acronyms. There are also some just very, very minor corrections that I wanted to see, including breaking up some of the very large, long paragraphs so that they're easier to read. And then some items that I wanted to make sure that we clarify. So for example, on the August 27, 2021 meeting minutes, towards the bottom in the second paragraph, I think it's actually in the sentence that begins, Rep. Sablan referred to Ms. Sablan's statement that the law would be in violation of the constitutional authority. I believe that was a reference actually to Ms. Salas, who made the statement, and so I think that needs to be corrected. And then when I asked for any legal opinions from the Civil Service Commission, I believe that Ms. Salas indicated that she did not have any legal opinions on her, not any statements. But we can double check that and just clarify that. And then when Rep. Babalta on the next page asked what the status of the review done by the Civil Service Commission was, Ms. Salas answered that it was done, and I think by that she meant that it was completed, right? And so I'd like to just make sure that that's clear. And then the acronym for the Overdose Data to Action Program is actually OD2A, and this is in the second paragraph on that page. So it should read OD2A, not OD28. And we should spell that out first so that it's clear what program we're referring to. Another correction is Eleanor Cabrera was the Overdose Data to Action Program Manager. And that should be corrected in her title. And then on to the next page. So this would be on page 4 at the very bottom. Julian Camacho, the question was posed whether they had assisted in, DYS had assisted in drafting House Bill 2215. And I wanted to make sure that we had for the record what DYS's response actually was. I believe he said yes, but I'd like to revisit that in the record. And that's it for the meeting minutes for August 27, 2021. Colleagues, did you have any comments? Are we ready to adopt the meeting minutes with those changes and clarifications? Okay, may I have a motion, please?
Second.
Motion has been made and seconded. All in favor of the motion to adopt the meeting minutes for August 27, 2021, please say aye. Motion, all opposed, please say nay. Motion carries. The meeting minutes for August 27, 2021 are now adopted. Second, for the meeting minutes for October 18, 2021. Did anyone have any comments or clarifications for these meeting minutes? Okay. I wanted to similarly ask for some technical corrections to be made. I do think we need to double check the names for the Medicaid programs that are referenced in these meeting minutes. And so like the Medicaid Information Management System, the Medicaid Transformed Medicaid Statistical System, and then to just spell out MES since that's the first time that it's being referenced in that. I think we also need to spell out MSISAC. I'm actually not sure what that stands for. So we could just verify that with the Medicaid program. I'd like to correct the spelling for Mr. Ty Dorham's name. And then for the paragraph on opportunity to expand the dialogue further, I just wanted to clarify that that sentence should read, she added that there is the opportunity to expand the dialogue further beyond this legislation. And that's it for, oh, and then at the very bottom, I'm sorry, just to strike out the word additional. So it should read, Rep. Sablon suggested that they add language to the bill to address these concerns. And that's it for corrections and clarifications on October 18, 2021 meeting minutes. Colleagues, any questions or comments? Oh, and just for the record, I'd like to recognize the presence of Representative Attal. Thank you. May I have a motion then to adopt the meeting minutes for October 18, 2021?
So moved.
Motion has been made and seconded. All in favor of the motion to adopt the meeting minutes for October 18, 2021, please say aye. All opposed, please say nay. Motion carries. The meeting minutes for October 18, 2021 are hereby adopted. And then finally, for December 6, 2021, colleagues, are there any questions or concerns at this point or clarifications that you'd like to make for these meeting minutes? Okay. I have a few that I just wanted to make for the record. One is to clarify that all of the invited testimonies, the guests who provided invited testimonies came from the public school system. So that should be clear in section E. Second, I wanted to just revisit the record and clarify the part on the next page, on page 2, 73% of students have been tested, according to Dr. Leeweg, and 30% resulted in antigen testing. I wasn't sure what that meant, and if we could either clarify that or just strike that. I also wanted to make sure that we broke this up into paragraphs, shorter paragraphs, where it makes sense. I'll work with Ms. Johnson on that. And then, COVID-19. And then on the next page, on page 3, I think it should actually read the teacher-student ratio. I'm sorry, it should read the student-teacher ratio of 25:1, not the teacher-student ratio. Just so please correct that, Ms. Johnson. And then for the part towards the end of that paragraph, or that page, on page 3, the sentence that begins, Rep. Attal confirmed that they want to know where the money is coming from and how it is being used, and that they will wait for the information. As I recall, I think you were referring to the committee, Rep. Attal, so I think I'd just like to clarify who they is. And then on page 4 is just to correct the acronym for HIPAA. And also on page 4, on section F, is to correct the spelling for CEO Esther Munoz's name. And then on page 5, in the middle of that paragraph, with the sentence that begins, Rep. Manglonia asked if they had begun to work with the inner island portion of medical referral. And that should read more clearly that the question was posed to Mr. Sablon of medical referral if CHCC had begun to work with the inner island medical referral. And then on page 6, in the first paragraph, the reference was made to indigent patients, not indigenous patients, so we should correct that. And then correct the spelling for Chrysostomo, and once again for the acronym, the Overdose Data to Action Program, it should be OD2A, and we should spell that out when it appears first in these meeting minutes. And that's that for the December 6, 2021 meeting minutes, colleagues. Are there any concerns or questions at this point? Ready? May I have a motion, please, to adopt the meeting minutes with these amendments for December 6, 2021? Motion has been made and seconded. All in favor of adopting the meeting minutes, please say aye.
Aye.
All opposed, please say nay. Motion carries. The meeting minutes for December 6, 2021 are hereby adopted. Thank you, colleagues. Next in our order of business is public comments. And we do have one member of the community who is here to offer public testimony on one of the bills that's on our agenda today, House Bill 2280. And if there are no objections, colleagues, I'd like to invite Dr. Ann Earhart into the chamber to receive her testimony. Thank you, Dr. Earhart. Welcome. Good afternoon, and if you could please state your name and the organization you're representing into the record, and then you can begin your testimony.
Thank you. My name is Dr. Ann Earhart, and I work at Pacific Clinical and Consulting, a private sector psychological services company. And I want to say good afternoon, Chair Sablon, Vice Chair Staffler, Vice Speaker Atau, and Representatives Babauta and Manglonia. Thank you for having me. As I said, I'm Dr. Ann Earhart, a licensed clinical psychologist, and my colleague and husband, Dr. Adrian Bren, and I have been practicing in the CNMI for over 25 years, both in the public and private sectors, as well as volunteering for a number of those years with the Red Cross in disaster mental health. So I'd like to start by expressing our appreciation for your consideration of the Psychology Interjurisdictional Compact, which is a mouthful to say, and it's abbreviated as PsyPact, which is much easier to say. We believe it has the potential to benefit the CNMI by providing another method for accessing much-needed psychological services. The Association of State and Provincial Psychology Boards, which I prefer to refer to as ASPPB, is the association of all psychology regulatory boards throughout the United States and Canada. And ASPPB created PsyPact to allow psychologists to practice interstate telehealth, as well as to practice for a limited period of time while they're physically present in a compact state. The goal of PsyPact is to improve access to mental health services by providing a mechanism for the ethical and legal provision of psychology while reducing regulatory barriers to accessing care. As people understand more about mental health and are willing to reach out for help, the number of those seeking services continues to increase. Unfortunately, like many other health professionals, psychologists aren't always easily or quickly available in underserved areas like ours. Higher demand for services in the CNMI has resulted in long waiting lists, which obviously doesn't serve our community well. PsyPact would allow the CNMI to access a larger pool of psychologists, including those who deal with specialized populations or provide specialized treatment. PsyPact would also be helpful in maintaining continuity of care when patients travel out of the CNMI for school, jobs, medical care, and for military families who often move very frequently. Even before the pandemic, psychologists were using telehealth as a means of responding to the demand for services, especially in rural areas. Because of the pandemic, the use of telehealth has accelerated as face-to-face services have been limited. For many conditions, treatments are as effective via telehealth as when patients come to the psychologist's office. SIPAC provides protection to the public by certifying that psychologists have met acceptable standards of practice. Importantly, it provides compact states with a way to address disciplinary issues that occur across state lines. SIPAC promotes public protection where otherwise little exists for the interstate practice of telehealth. In summary, SIPAC has many potential benefits for the CNMI. The ability of psychologists to deliver mental health services through telehealth could greatly increase access to care for the CNMI, particularly for those needing services on Rota and Tinian, for people who may avoid accessing psychological intervention locally due to stigma or shame, for people who have special or complicated mental health needs and require access to specialized services, and for those uncomfortable with seeking care from someone they may see out in the community. SIPAC legislation has now been enacted in 28 states, including the District of Columbia, and introduced in 6 more. In fact, I have, if you're interested, a map for you to see which states are currently active and effective, and which ones are, I guess your sergeant at arms isn't handy.
Is our sergeant, actually, John, if you could assist? Yeah, thank you.
Okay,
Dr. Earhart is submitting materials for the committee.
this is just to distribute to the members so they can take a look. Thank you very much. So what I'm hoping is that with your support, SIPAC will soon be enacted here. Thank you very much for considering this mental health legislation.
Thank you, Dr. Earhart. And if you could provide a copy of your written testimony as well, that would be helpful for the committee. And colleagues, we did distribute earlier a letter that, actually several comments that have been submitted on this bill from, one is a letter dated December 14, 2021 from Drs. Earhart, Dr. Bren, and McCullough, and also a letter in support of this bill from Dr. Amanda Borja Hughes, dated December 30th, 2021. And that should be part of your materials for today. Did any members have questions for Dr. Earhart at this point? I just had one question, Dr. Earhart. Are you aware of whether any other territories have already adopted SIPAC legislation?
To the best of my knowledge, they haven't, except for DC, the District of Columbia, but no other territories yet have done that.
Okay.
And I don't think any of them currently have pending legislation either.
Okay, so we would be the first.
We would be.
Okay. Well, thank you. And for your information and for the members' information, the Healthcare Professions Licensing Board has requested additional time to review and comment on this bill. They are having a meeting on March 16th. This bill is on their agenda, and then they expect to be submitting written comments on the legislation thereafter. But they have invited the members of this committee to attend the meeting, and I believe their meetings, they should be open to the public. So Dr. Earhart, perhaps you and your colleagues may be interested in attending that as well.
Very much, yes. Thank you for letting me know.
Okay, thank you.
Thank you.
If you could submit that to Ms. Malia, who's right behind you. Yeah, thank you. Thank you, Dr. Earhart. Are there any others in the public, members of the public who would like to submit comments at this point? I do not see anybody. So we will now close that portion of this meeting and move on to our next order of business. So we are skipping over the panel briefing, colleagues, since we will be covering that part tomorrow. And we'll go right into, I'm sorry, that should read F, which is markup. So 2 bills are on this agenda. House Bill 2277 to establish the CNMI Qualified Medical Assistance Travel Program. As an update, the CEO, Dr. Munya from the Commonwealth Healthcare Corporation, has requested another week's time to submit their proposed amendments for the medical referral legislation, and specifically to define medical referral as an integrated hospital service. And they're working on the language for that. She said that it will be ready by next week, Friday. And then there are some other amendments that I forwarded to her that were discussed at our previous meeting when we had this bill on the agenda. So we should be expecting that next Friday. Are there any other comments or concerns at this point?
Madam
Yes,
Chair,
Representative Patel.
thank you, Madam Chair. Just on the CEO's request for an extension, I know that she's trying to make sure that Medicaid and Medicare addresses the issue. I was wondering if the potential amendments that she will be providing the committee would also allow our Medicare and Medicaid patients the opportunity to actually receive payments for the care outside of the cinema, because I know that that's one of the biggest challenges of Medicaid and Medicare patients is when they go off island, that they're mostly Medicaid. Sorry, Medicare, they still cover them outside of the cinema, to make their payments for the hospitals outside of the cinema. Maybe considering the medical referral patients as satellite offices of CHCC.
Hmm.
You know what I mean? Like if they send somebody to Strop Hospital, or let's say Guam, right, GMH, that it's a satellite office of CHCC, so that they can actually still utilize the Medicaid funds to address these payments. This is one of the bigger issues that we have as a medical referral program over the years, right? It's always been under the administration, and unfortunately, when it comes to payment, even Medicaid patients, it still falls under indigent care for the central government. So maybe this is something that we might ask the CHCC CEO if this would allow the Medicaid recipients to be able to utilize those funds to address their medical needs outside of the cinema.
Yeah, my understanding, thank you for that,
Yeah.
Rep Atta. My understanding is that Medicaid beneficiaries should be able to have their care covered by Medicaid when they go out off island. And I know that the medical referral program is now in transition to CHC, and it sounds like they've been doing a lot of work, just really getting to the bottom of where all the issues are. And as you may recall, Helen Sablon from the Medicaid office did say that there it was her understanding, her impression that there are a lot of services, including treatment, when medical referral patients go off island that could be covered by Medicaid, but something gets lost in the billing process. Something gets lost, I think, along the way. And you're right that it has ended up getting covered as an indigent service, or in the past, promissory notes were issued, or hospitals that could not were located in foreign countries that Medicaid could not pay for whatever reason. Medicaid beneficiaries were being sent there, and so I think that they're really trying to sort all of these different issues out to maximize Medicaid reimbursement, particularly when so many of our medical referral patients are Medicaid beneficiaries. So, yeah, I thank you for raising that. I will bring that up with the CEO again. Because my understanding is that the amendments that they are working on are intended to maximize Medicaid coverage for medical referral.
And with that, maybe that's something, barring statute of limitations, we can actually try to address previous previous patients that were sent that are actually under the program, so we can get those monies back and replenish our general fund if possible.
You mean with respect to the promissory notes?
Yes.
Yeah. So we did discuss that as well. And just for the members' information, as you may recall, the Attorney General actually said that those promissory notes are invalid and were not lawful, right? And then on top of that, because a lot of them were issued to people who are already indigent, they're also the vast majority of those promissory notes are also not considered collectible. And so I think my understanding is that it is CHCC's position that those cannot be collected, and they just need to be written off. It's not going to be a liability of CHC, and if they're not collectible anyway, then CHCC is not going to be pursuing them.
Sure. And I just bring that up because there's other Medicaid patients that might possibly qualify where we can recover those funds back to our hospitals
Oh,
that can be
okay.
replenished back to general fund, i.e. what like DPW is trying to use the federal highway funds for land compensation, for example.
Okay, like
Now
if there
that-
were Medicaid patients
Yes.
who were issued promissory notes and
Yes.
their care could have been covered by Medicaid.
Yes.
Oh, that's an interesting point.
Yeah.
Okay.
That would be able
yeah.
to address, maybe not necessarily go to the general fund, but would at least assist in the seed funds for CHCC for the future. So it's an unencumbered funds and non-lapsing funds that they can collect for whatever term
Mhm.
possible.
Okay. Thank you.
Thank you.
I am taking note of that and we'll raise that with the CEO. Any other questions or concerns that members would like to raise at this point with respect to medical referral? Okay. Thank you, colleagues. And then moving on to the second bill on the agenda, as stated, we will hold off on action on this bill until after we receive comments from the Healthcare Professions Licensing Board, since they will be playing an integral role in the CNMI's participation in SIPACT. And so that will happen sometime after their board meeting on March 16th. And with that, I have no other announcements. Do any members have announcements? Okay. And then moving on to miscellaneous. Any members have items for miscellaneous? Okay. None?
Madam Chair.
Yes, Representative Maglonia.
Well, maybe this could also tie in with Part E. As you know, Vice Chair Karina of Ways and Means is tasked with identifying or looking at all these sole source contracts as pertaining to the COVID response. And so I am hoping that she would be allowed time to ask questions during the briefing in regards to some of these contracts. Is that something that the chair will allow for her to do?
Thank you, Representative Maglonia. Yes, members who are not members of this committee but have questions for our panelists and would like to receive updates will be welcome to attend and will be welcome to answer or ask questions. So yes, that would extend to Vice Chair Karina Maglonia. I do believe other members will be submitting questions to other panelists as well. So I would like to ask members to have your questions prepared ahead of tomorrow's meeting. We have 5 panelists. We will be starting with the CEO, Esther Muñoz, since I think her time with us will be limited. She has another engagement. So we'll begin with her update and then move on to the other panelists. But there are certainly a lot of issues and questions that I think members will be interested in hearing about, and so we will focus entirely on this COVID briefing for our meeting tomorrow. And one other issue I wanted to raise for our vice chair, who is also the education committee chair. It was suggested that we invite PSS to the meeting, since there would be some updates from the PSS perspective with respect to this COVID-19 response. And I think that the education committee was already planning to have a meeting with PSS. Is that correct?
Thank you, Chairwoman. We were planning to have a education meeting, but we rescheduled because the commissioner would be off island until the 26th. And so that was kind of why we decided to reschedule. And so we could address it then. He did say that one of his surrogates could come to a meeting if we let them know in advance. So I'm not sure if you still wanted to invite them for that panel or not, but if you do, let me know and I can arrange that.
Okay. Well, I think that, it would be fine if do you have a date yet for the education committee?
After the 26th is the timeline, so not set in stone yet.
Okay.
Working on it.
Okay, thank you. At our last meeting I think it was in December, Yeah, at our last meeting in December, the PSS officials who attended had some thoughts about how information protocols could be improved between PSS, the COVID-19 task force, and CHCC in a way that would both protect patient privacy, but also assist PSS in responding in a timely way as the COVID-19 cases were surging in different schools. So I think that we could ask for some updates. I did share this information with the CEO from CHC since she wasn't able to attend our last meeting with PSS. And I think that one of the lingering issues for why there has not been improved information sharing is because the request hasn't been made by PSS formally to CHC. So perhaps we could invite them and bring everybody to the table since they will all be here tomorrow anyway, and maybe we could facilitate a solution in that area.
So I will reach out to them this afternoon.
Yeah.
Okay.
Thank you. And are there any other issues or comments at this point, colleagues? I think we could recess then until 1:30 tomorrow if there are no objections. Okay, so we are hereby in recess. It is now 2:31 p.m. and I will see you tomorrow at 1:30. Thank you.